Breast reductions involve essentially making incisions on the breast to remove breast tissue to help alleviate symptoms that the patient is having from having large breasts. The symptoms that patients have with large breasts are some patients will have back and shoulder pain, neck pain, rashes underneath their breasts, and infections. There's risk involved with any surgery that's done. With a breast reduction, some of the unique risks, although they're very low, one risk is nipple loss. And less than 1% of the patients, they can have partial loss of their nipple. Other risks involved are poor scarring or asymmetries, which can be treated with additional surgeries. The recovery time with a breast reduction surgery is around 2 weeks. And generally patients can go back to heavy lifting and go back to all their activities after 4 to 6 weeks. In most situations, breast reductions are covered by health insurance, but there are some criteria that do have to be met, and there's some guidelines we have to follow with that. Actually, there are. In a lot of situations, patients with large breasts also have sagging breasts. So when you do a breast reduction, not only do you reduce the size and volume of the breast and the weight of the breast, but you also lift the breast and lift the nipple in doing so. So after having a breast reduction, if a patient has large sagging breasts, they're going to have smaller breasts but also perkier breasts as well. One of the newer techniques in breast reductions that is able to be used in patients that don't have extremely large breasts is called a vertical reduction, where the patient's left with a scar around the nipple and a scar down the breast. If somebody has larger breasts, then we have to use some of the older techniques where the patient will have a scar around the nipple, down the breast, and a scar underneath the breast. And if somebody has extremely large breasts, then we may have to take the nipple off, reduce the breast, and put the nipple back on as a skin graft so that the nipple survives.